I'm here talking with Dr. Lisa Fitzpatrick.
Hi.
She is an infectious diseases physician and a medical epidemiologist.
I'm a public health doctor. How about that? Make it easy for people.
Okay, public health doctor who's been in DC for
Too long.
Forever,
since 2007.
And I've known you that long, I think.
Yep.
Since
my
Howard.
Howard days started in 2008. Yep.
Okay.
We go way back, Erin.
And then started the Care Center in Southeast at United Medical Center.
Yep.
And that was in
2012.
Okay. And then now has formed her own company.
Actually, it was before that, wasn't it? It was 2010.
I started in 2011, so I think it was just
2010, yeah,
end of
wow.
2010, and then
Yeah.
here we are now.
What
So,
an adventure we've been on.
I mean, yeah, so much is different and so much is the same.
Right.
But now Dr. Lisa Fitzpatrick has her own company, Grapevine Health, and she is trying to, demystify information, break down information, make it
That's
easier for
right.
people, focus on health literacy.
Yeah. Health literacy is this idea that you understand what doctors are saying to you, you understand your body, you understand information related to your health, and then you know how to use it to make sure you stay healthy. And so, as you know, doctors and healthcare providers speak in a lot of jargon. In fact, I was with I've started shadowing people when they let me. And the doctor was using words like ischemia and revascularization. Like, that's a 6-syllable word. And not explaining it. So the purpose of Grapevine Health is to help people understand health information. So
Yeah, and I think sometimes people meaning medical professionals, like really underestimate like what we're talking about with health literacy, like how really low you have to break it down, like really simple terms. My experience is most of the folks that I'm seeing in the community don't know their diseases and they don't know their medicines at all.
the blue pill and the white pill. I take the
Exactly.
little round blue pill or I take the oval green pill, yeah. But I think we don't emphasize it enough to help people understand why they need to know the names and why they need to know what the medicines are doing. And I think that's a big reason we have problems with people taking their medicines consistently because we don't explain to them why we're giving them so much medicine. And you know how many times I've heard us be accused of being drug dealers? You all are nothing but drug dealers. All you do is give out pills. And so that's a trust issue. Because if they come in, this guy said to me, I came in for a headache and the doctor gave me 3 prescriptions and never asked me about my headache. So the prescriptions were because he hadn't seen a doctor in about 10 years.
Oh my gosh.
And the high blood pressure was causing the headache, and he also had diabetes. And he learned it because he went in for a headache. But the doctor didn't explain all that. So to him, the optics are really bad when we're just prescribing, and not making sure people understand what's going on with their body and why they need medicine.
I think this is a larger conversation. I think a lot of it has to do with our healthcare system and the delivery of healthcare in these 15-minute appointments.
Yes and no. I think, like this person whose visit I was shadowing, how long does it take to say you've lost blood to your eye versus the ischemia? In 15 minutes, you can say a lot. In fact, doctors do most of the talking, unfortunately. There's a study that shows that.
I'm sure. What is the issue then? I'm just curious because I am a nurse practitioner, right? And so I feel like nurses do a lot of the education in health settings. So what is the problem? Is it education in medical school? Is it why aren't doctors properly teaching their patients?
Well, because we have a language all our own, and we're so accustomed to talking to each other and speaking in this language. And the other thing is, there are so many medical shows on TV now, and people can Google things. And I think there's just this notion that people know these things. Like, you've heard this term before. It's so popular. People know what cardiovascular disease is and renal disease, when actually, if you ask someone, like, what is renal? Like, I'm not sure. Oh, that's kidney. Okay, where's your kidney? I'm not sure. So I think doctors don't always realize people don't understand what we're talking about, even their own disease. And so we talk over their heads because we feel like they're connecting. And see how you're nodding right now? A lot of patients will do that too. You just kind of nod along and not stop and say, sorry, can you say that in a different way? Or what is that now? So I think that's what's happening. Like, we get a pass. No one's holding us accountable to speak in plain language.
Okay, well, that's interesting. I'm
And
glad you're
doctors
saying.
need to realize we are still smart if we speak in plain language.
Okay, I like that. I can definitely agree with that for sure. So one thing I wanted to talk about a little bit is prevention. So I'm big on prevention, right?
Me too.
I feel like our healthcare system spends no money on prevention, and we're just hitting things, at the end of care, putting out fires in the emergency rooms and all these things. So one of the big things that I want to focus on is prevention, obviously getting folks in early, upstream, all these types of things. I'm sure you can agree with that, right? Like most people would agree. We've been doing a lot with vaccines. I want to get your Dr. Lisa on the streets opinion about the importance of vaccines.
This is one of the greatest public health achievements there is. Vaccines to prevent deathly diseases. Before COVID and SARS-CoV-2 came along, we had so many vaccines that were administered to people year after year. Or let's say you're taking a trip abroad, you're going to Africa, or you're going to a country where there's some really bad diseases. We have vaccines for some of those. And I've taken a bunch of them on my travels. And so those vaccines have prevented me from getting deadly infections, cases of meningitis or really bad diarrhea. Unfortunately, the pandemic threw a lot of information at people who were unprepared to receive it because we never prepared them to receive it. So we haven't done a good job explaining to people in general why vaccines are important, what they do, and also how we come to have a vaccine. So we talk to people about clinical trials. Some people were hearing this for the first time ever. What's a clinical trial? And are you treating me like a guinea pig? And so I think with this barrage of information we threw at people who were not prepared to really synthesize all the information, that was problem number one. Problem number two is that the information kept changing as the pandemic evolved. And over time, we'd say one thing and then someone would contradict that. And so then people just threw their hands up and say, well, I don't trust any of it. But the truth is, if you take COVID away for a minute, vaccines, measles, mumps, rubella, chickenpox, HPV. I mean, there's so many. I've had 23 different vaccines in my life. And so vaccines are a public health achievement that has saved so many lives, but we didn't spend enough time talking about that during the pandemic. And so because it's the first time, I think, worldwide, everybody is focused on these COVID-19 vaccines. So now when you say vaccine, for some people, they think COVID, when actually they should be thinking public health, prevention, healthy. These vaccines are protecting you from getting deadly diseases, COVID aside. And so I think now we're at a point where there's so much distrust around public health, around research, around the COVID-19 vaccines. We have to repair some of this by taking COVID out of it for a minute and helping people understand historically, look, we don't have smallpox anymore. A lot of places, have you ever heard of polio? Polio has been eradicated in a lot of places in the world. How do we do that? We did that through vaccines. So just bringing it back to all these public health accomplishments before we even knew about the pandemic, I think would be really helpful so that it can start to address some of the concerns now people have around the COVID vaccines. Right. That's bleeding into all vaccines.
And what about safety, though? Because I think that's what people first are concerned about, the safety issues.
So let me just acknowledge one of the mistakes we made when the COVID vaccines were released is that when people came up and said, I have this weird side effect, could it be the vaccine? So many of the scientists were like, absolutely not. And that wasn't right. That was a big mistake. I remember a woman reaching out. You remember Clubhouse? You know, the app. Did you hear about Clubhouse? It emerged during the pandemic, and so it had all these chat rooms and different conversations. And so there were all these conversations around COVID-19. It was like being in a group chat, like radio, audio only.
Got it.
And so this woman asked me, after I got my vaccine, I started having heart palpitations. Do you think that was my vaccine? And you know what I said to her? I said, I don't know.
Right.
And that's all we had to say. But instead, people were very dogmatic. Absolutely not. Like, that wouldn't be a side. But guess what? We still are learning. You remember when someone suggested that their menstrual cycle changed because of the vaccine? And a lot of people jumped out and said, oh, no. Why would, no, that doesn't make sense. But it was proven later that something is going on. So we have to admit the limitations. Like, our knowledge, we can't know everything about it. So that was, I would say, one of the big reasons people were skeptical.
If we're not sure, how do we say to the masses, get this, even though we're not sure? And then that sort of moves into the issue of like the hesitancy stuff.
Yeah, but see, safety was never my concern for the COVID vaccines. And the reason is because the clinical trial process is tried and true. It's been proven. All these other vaccines I'm talking about, all the medications in the pharmacy, on the shelves, over the counter and behind the counter, all of those medicines could not be available for people, whether it's a heart disease, high blood pressure medicine, a diabetes medicine. They all went through the same process as the vaccines. And the bar for safety was already proven in the first phases of the trial. And so people didn't understand that any clinical trial goes through phases. And the first phase is this thing safe, whether it's a drug or a vaccine or something else? And once they've proven that it didn't kill anybody and it didn't maim anybody, then it can move on to the next phase. And so we were having to educate people about all of these things during the pandemic. And so safety was never a concern for me. In fact, I volunteered to be in the Moderna trial.
Oh, that's right.
What better way to demonstrate to people I wasn't concerned about safety. My biggest concern around the vaccines was who was going to have access to it.
Right.
Not whether or not it was safe. That's not to say I think nobody was harmed by the vaccine. I could never say that. But I think the number of people who benefited, just looking at how much the deaths dropped off from COVID, or the number of people who had really severe side effects from COVID, like that drastically dropped off, and you can see it. So let's say, 100 people were somehow impacted negatively by the vaccine. Look at the millions of people who potentially benefited from the vaccine. So you have to weigh that, like 100 or 1,000 people versus millions. We haven't also done a good job helping people understand this idea of risk. But we take a risk every day, but we just don't think about it when it comes to our health. Like walking across the street has some risk. Getting behind the wheel of your car has some risk.
Taking an aspirin, taking a Tylenol, right.
All of it. And we don't think about it in those terms.
Well, and I think so this hesitancy issue is that, your experience being out there and talking to folks, is this because they were afraid? Is this because it was COVID and this barrage of information? What do you think the hesitancy thing is about? Because we haven't really seen that with other vaccines, and now it's sort of, maybe a little bit, right? But now it's such a big issue.
There were so many issues that play there with the hesitancy. When you look at the media coverage around this, everyone was talking about Tuskegee. But it actually wasn't just that. I think it was that for some people, but it was the conflicting information. I think politically there was a lot of damage because, and I've said this before publicly, so I'll say it here again. Dr. Fauci said, it's unlikely we're going to have a vaccine in a year. And that made sense. It was a good estimate that it takes us this long in general. Like I've already said, there's so many vaccines. There's never been a vaccine produced in a year that was ready for the public.
Right.
And so he's saying that based on historical knowledge. He's a researcher. He understands how long it takes to develop a vaccine. Now, at the same time, Donald Trump was saying, oh, yeah, we're going to have a beautiful vaccine, right? So if he's saying we're going to have a vaccine in a year and Dr. Fauci is saying we won't, people are confused.
Right.
And then people started to sort of divide along these political ideologies. And then guess what? We had a vaccine in a year. So then we had to backtrack and explain, oh, well, we didn't think we could, but guess what? We did it. And so that's why people thought, well, it's rushed. We heard that a lot. This vaccine was rushed and it's not safe. And so I'm not taking that vaccine. And then there's just a lot of confusion and bad information out there about vaccines, the vaccine development process, what's safe and what's not. And so all those things, I think, were sort of coalescing to create all this vaccine hesitance, or people deciding, well, I'm not taking it. But what we learned at Grapevine Health during the pandemic is that if you put a trusted messenger in front of someone who had all these questions and you answered their questions, including saying, I don't know, people were getting vaccinated. We worked with one organization. None of their employees wanted to get the vaccine. And so we had 2 education sessions. I did one, and one of our other doctors did the other one. 75% of those people got vaccinated.
Interesting.
And it's all about giving people information in the way they can understand it from a trusted messenger. And also just being humble about what you don't know. But I think a lot of people haven't thought about the fact that they swallow all sorts of pills every day and never question, well, how long did it take to develop this medicine? And knowing all the side effects. And they still take that risk. That is a risk to take those medicines. And so just sort of framing it for people that way, and they, would say, yeah, that's a good point. I hadn't really thought about it like that. But the primary thing was just educating people about what a vaccine is, what it's doing, and how we come to have vaccines.
And when you say trusted messengers, like who is that to you? Who are the trusted messengers?
For these people we've been working with is Black and Spanish-speaking doctors, because Grapevine really focuses on those communities. A lot of people haven't seen a Black doctor. Or they haven't had, someone like a Dr. Fabian Sandoval talking in Spanish, answering their questions in Spanish. There's a lot that gets lost in translation. We think people understand us. But to see, him work his magic, we went on the street with Dr. Fabian in Columbia Heights. And he was answering but it's the same kind of questions, like what's in the vaccine, what does it do to you, is it safe? It's the same, just in Spanish. But because he's standing out there talking to them in their language, really powerful. Yeah.
That's cool. And so now we're post-pandemic, right? And so, but we still have some cases of COVID, not as many.
Yeah.
And so what is your advice about the vaccine now and how we approach it?
Well, so these boosters, they don't like to call them boosters. They like to call them vaccines. But I think the challenge is people are no longer afraid or feel threatened by COVID-19. And even in my own experience, I've had COVID in the last year, and I barely noticed I had it. And so it's no longer perceived as a threat. And the truth is, the data bear it out that the strains of COVID we're seeing now, they are not landing hundreds of thousands of people in the hospital or even sending people to the emergency room. So I think that's probably the biggest reason people aren't taking the COVID vaccine, because I know we have really low uptake rates of the vaccine. And these are the things people are thinking. Why would I bother getting a vaccine when COVID's like a cold? And we can't tell them it's not. I mean, that was my experience, is that I've had colds that were worse than what I saw when I had COVID a few months ago.
But isn't it similar to the flu? Because the same could be said about the flu. Right now, it's similar in that the vaccine will be this annual thing, and some folks are going to get it really severely and some folks won't. Is it similar or is it different?
I don't know.
Okay.
And I think if we look at, and I haven't looked at the most recent COVID data versus flu data, and I should do that to educate myself. But I think it's hard to say. So the people who ask me if they should get a COVID vaccine, if they're older people who I consider frail, who don't have a lot of resistance to fight off infections, then I say, yeah, you should get it. But, for young people who are like, well, why should I get this vaccine. We already know that getting the COVID vaccine doesn't prevent you from spreading it to someone else. And so that's also a hard hill to climb when we try to tell people you should get it because it like keeps you from spreading it. It's just that we've learned so much about this and it's evolved over time. And so this is now just really an individual decision. I still am a huge fan of the flu shot, though, because flu has always killed a lot of people. Right. Kids, elderly, people with, immunocompromising conditions or who have weakened immune systems.
Right.
And I just don't know that where we are now, that COVID is still doing that to the degree flu always has. It certainly overtook flu during the pandemic. But
where are we now?
I don't know. Have you looked at this?
I think the cases of COVID are kind of rising now. I think depending on where you are, there's a little bit of an uptick. Still, I think the hospitalizations are not, super high. But I guess I'm thinking more around this, the flu is usually 50 or 60% accurate to whatever the strain they think it is when they develop it in June. So is it similar in that way? Like we're not going to totally get it perfect, but it's the same principle?
Yeah, absolutely. I think so. And I think the COVID vaccine provides some protection. And so for me, it's not apples and apples. When people get the flu, it's not, to me, I haven't seen as an infectious disease doc, and maybe it's because I see the sickest people.
True.
It's not like I got a little bit of flu.
Right.
It's like my bones are aching. I can't get out of bed. Whereas the experience with COVID now, because the virus has changed so much, and it seems like every time it changes now, it's not as powerful as it was in the past. So I don't know. I mean, these are good questions you're asking, and I'll be the first to say I'm not prepared to answer, but I still, my instinct is if people are wary about getting the COVID vaccine, I still would say you need to think about the flu vaccine. And then RSV also.
Right.
There's a new vaccine for that, too, and we don't talk a lot about it, but same recommendation for seniors, people with weakened immune system, kids. Like RSV, respiratory syncytial virus, has killed, millions of kids over time.
Right.
Not every year, but it's something to take seriously.
Yeah, I just came from a meeting in Ward 8 at a community meeting in one of the residential public housing communities, and there was some police officers there, and they were saying, what is this thing? Like, some of my friends are getting this respiratory thing, and it wasn't COVID, and what is it? And so we kind of had a similar conversation about all these other respiratory viral illnesses that can knock you out, and you may or may not know what they are. There's
what
not a
were
test.
They saying about it? Were their friends really sick? Or?
Yeah, it sounded like flu. So they didn't have COVID because they had done COVID tests, but they hadn't done flu tests. And so it was a little bit of okay, well, there is a test for flu. You can't test for all these viral illnesses that are out there. But again, sort of what are you going to do about it, too? I think the principles of staying home and taking, drinking lots of water and rest and Tylenol and these types of things are similar.
Yeah. One of the rationales for why people should continue getting COVID vaccine is because of the concern about long COVID.
Right.
But I just saw there's a study that shows Paxlovid, the medication you can give people to shorten the duration of symptoms with COVID, doesn't prevent long COVID.
Oh, boy.
Now, that's going to be interesting to throw in the mix, right? Because now you take away potentially an argument for convincing people to get the vaccine. But the testing is also an issue because when you have a cold, you don't go seeking, what is the reason I have this cold? And so now people are questioning, should we be quarantining? Are we still, why bother getting tested? And so I can't fault people for not wanting to know if they have COVID because we're sort of all over the map when it comes to what to do. How long you quarantine? You remember when it was 10 days? And then it got cut down to 3 or 5 days. And,
and now it's...
And so now when COVID's not making you deathly ill or sending you to the ER or the hospital, well, why should I quarantine? I'm sure I've sat on the plane next to people with COVID. I just wish they would cover their mouth.
Well,
that's the one thing that just shocks me right now. After everything we've been through, how am I still seeing people not covering their sneeze and their cough? It is mind-blowing to me that people still are not practicing cough hygiene.
But what about the masks?
I still wear my mask on planes. You know why? Not necessarily because of COVID, but because I like how I didn't get sick.
Exactly.
And so there's a barrier there. Like, everything became so controversial during the pandemic. But the truth of the matter is, if there's a barrier there, it's going to cut down on the amount of, spray when I cough and sneeze. And so I like the idea, even if people are looking at me. I mean, I've been in areas where I'm the only person with my mask on, but I'm thinking, well, at least I'm not going to get any germs.
Well, now it's kind of a mixed bag too, right? When you go in places, you kind of see people, but I think it's less stigmatized. So I feel like it's a little bit more PC to like wear a mask, just if you feel like it, or if you do have a cold, right? Like, not a bad idea.
I wish people with colds, any kind of respiratory thing, I wish they would just wear a mask. I don't care if you have COVID.
Right.
You could have 1,000 other things, and I don't want it.
Exactly. Or if you're running into a grocery store in the winter, like, just throw it on anyway, because probably somebody in there has got something, right? So it's not a bad practice. One other thing that you said, though, so the idea that if you get the vaccine, it doesn't mean that you can't spread it to others. But what about this principle of community immunity? So getting enough people vaccinated with any given vaccine to protect the community, right? So I think because we look so much, at least in this country, of like individual health, but then like population health, right? And communities of people. So what can you say about community immunity, I guess really with COVID now or flu or any of these?
I think I'm in the minority in how I think about this because I think most of the benefit conferred from COVID-19 vaccines were from that original series. Okay. I think because the whole purpose of a vaccine is to show your body what it looks like and amp up their protection, right? So there's some memory inside the body from having those first 3 shots. And so there's no way for us, let's just be honest about that. There's no way for us to know, but beyond a shadow of a doubt, how many infections are being prevented by the boosters or these annual. And I actually hope that COVID vaccines will not be annual. And the reason is because it has created such a challenge for us to get people to take the other vaccines now. And whether or not it's really needed, I will never know the answer. So it's for a certain population, sure, why not take the vaccine? This is a very unpopular view from an infectious disease doctor, but I think you have to really sort of weigh all the information along with like community perception and optics. Right. I would much rather someone get the MMR and their chicken pox than if they say, I don't want any vaccine. Why are you throwing these vaccines at me? It's like, fine, don't get the COVID vaccine. I want you to get your measles, mumps, rubella. Right. I want you to get these are things that can kill you. But we're not seeing that to the same degree with COVID. And so if you have to choose for the sake of vaccine literacy, take the COVID out of the equation if it's creating so much distrust, So, and I've just gotten really practical about it. Once upon a time, I would just say, come on, these are all vaccines and they're protecting us. But I just think there's a lot we don't know about the COVID. I'm still calling them boosters because to me, that's what they are. And I might be wrong about that, but I don't know. I get a lot of information just talking to people in the community, and I'm really saddened by how people now are just dispensing with vaccines altogether because they don't trust the COVID vaccine.
Well, and I think one approach is to just, when people are coming for their routine checkups and annuals and other vaccines, to just say, this is part of the offering, and is this okay?
They're putting COVID, they're just throwing all the vaccines away because now they've been awakened to vaccines. And because of all the misinformation and confusion and distrust around COVID vaccines, it's jeopardizing their willingness to take any other vaccines. And that's my big concern.
Gotcha.
As a public health person, we really need to restore some trust in all these other vaccines, like historically, that have saved so many lives.
Well, in fact, we kind of pivoted in December to go into schools to catch kids up on childhood immunizations because DC was like, very low. And
this is part of the reason.
right. Everything kind of got shifted.
People don't want to hear that. I mean, the government's invested a lot. And I'll be the first to admit, like, that was a remarkable achievement. Like, this, historically, what happened with the COVID-19 vaccines, like, that will go down in history as one of the biggest public health achievements there was. But now, looking at the severity that may pale in comparison to what we're up against, like there's a measles outbreak somewhere up in the East Coast now. What we're up against, if people just decide they don't want to take vaccines, I'm afraid for our future if people stop getting vaccinated.
Well, and one thing I was surprised at, and I didn't know this because I haven't been in the schools in a while, is that the parents can opt out of the HPV vaccine. When did that happen? Is that something that's been for...
I don't know that it was ever universally mandated, though.
It's definitely recommended, I guess, at a certain...
It's recommended for sure, I think there are a lot of places where we had a similar challenge with the HPV vaccine because people heard HPV, my kid's not having sex, they don't need a vaccine. They're not thinking about the long-term impact. People don't even know that HPV causes cervical cancer, which is something that can kill you if you're not getting screened.
Right.
So these are all health literacy issues that need to be addressed.
Well, and it's interesting, too, that babies get the hepatitis B vaccine, right, which is also transmitted in similar ways, and no one's questioning an infant.
Because we don't talk about hepatitis B being a sexually transmitted infection.
Right.
Yeah.
Yep.
It's all in the way we communicate about these things.
So what do you think the most important thing is now going forward in terms of education and getting? Is it just reaching people and re-educating or educating them? What would be your most successful accomplishment in reaching people?
We've got to restore trust in science. And when we say restore, we assume it was there before. I don't know that it was there. It's just that we didn't hear people questioning it like they do now. So maybe they were always skeptical, but they didn't have an audience or an opportunity to talk about how skeptical they were. But I think we have to find a way to help people value and embrace these scientific achievements. It's just amazing to me. We have so much illness in our country that's treated by medications and surgeries and a lot of these tests we do. If the trust and the belief in all of this technology and all of this information and experience we have just continues to erode, then what's going to happen? I mean, and the disparities will be even worse. I mean, they're terrible now. But what happens if we just continue to see people turning away from science and information we know that's really helpful to them? There's a lot of information we have about what works and what doesn't work. We made a lot of mistakes during the pandemic that's really turned people off, and we've got to get them back.
And
I don't think it comes by trying to convince them to get a COVID vaccine.
But what is the path to restoring trust? Trusted messengers?
Absolutely trusted messengers, of which you are one. I mean, I applaud you. Like, you've really stuck it out, Erin. I've got to give it to you. How many years has it been?
Well, this is like almost 2 years with C3.
I mean...
Oh, well, then maybe a whole
You've been
career.
working-
Maybe 10 years.
You've been working in the trenches for a long time and been kicked and gotten back up many, many times, and you're still at it.
Yep.
So that's what people want to see. I mean, I had a woman say to me, are you just here for right now, or are you coming back?
Yeah.
Because that's what they want to know. Like, where's the consistency? Like, don't just show up because you're being transactional or you want something from me.
That's right.
But are you going to be here when the chips are down? And so that's what it takes. You got to show up, and you got to keep showing up. Because they're not going to, trust us just from one town hall. I showed up in your community room and answered some questions, and then I disappeared forever.
That's right.
So, yeah, but it's hard to get people to show up, I think.
Dr. Lisa, thank you so much. This was such an interesting conversation.
Yeah, very fun for me to talk about.
Yeah, I learned a lot myself. So
Oh,
this
you
has been
did?
wonderful. Yes, please.
I know I sometimes have contrary views, and
Nope.
but it's healthy.
Nope, I think it's easy to understand, and I think it's great. I'd love to have you come back. Let's keep talking about these things.
I love it. Thanks for having me.